Well, this morning, News 5 is following through. We continue to highlight the challenges plaguing the healthcare industry.
And this includes overall staffing issues. The pandemic changed the game and made many reconsider their career paths. That, coupled with retirements, left a gap and a critical need for primary care doctors. New data shows Ohio is projected to be shy 1,200 primary care physicians by next year. And the U.S. will likely face a physician shortage of up to 86,000 by 2036.
The Cleveland Clinic is working to bridge the gap. They partnered with a local university to offer a program that addresses the national shortage of PCPs. The program gives students an accelerated path to become doctors in a shorter window of time. Mike Holden joins us live with a little bit more on how this works and the response from these new doctors. Good morning, Mike.
Guys, good morning to you. We have reached a real tipping point for this industry. There is a critical need for more primary care physicians, and regardless of how you boil it down, time is fastly approaching. So officials say the reason why so many people are opting out is one, lifestyle changes, but two, these med students say that there's a much easier path as far as better hours, higher pay, and that means entering specialized care. But this brand new program and partnership is changing everything, opening up new opportunities and allowing students to immerse themselves in the field, and they say so far it's working. As Olga Gresh walks the halls of the Cleveland Clinic and works with patients one-on-one, she says there's no better feeling than making a difference in someone's life.
Family medicine, I believe, allows me to have that extra touch with the community that maybe I wouldn't have had if I didn't do a different career or picked a different specialty.
Hi.
She is part of the first class of students graduating from the Transformative Care Continuum. It's a collaboration between Ohio University's Heritage College of Osteopathic Medicine and the Cleveland Clinic. Their goal is to address the national shortage of primary care physicians head-on in an accelerated, innovative format.
You're doing a 3-year program. It hasn't been done before, but it actually, I think, worked out perfectly, and we were able to be so well trained going into residency.
The program is a hands-on, immersive experience. Instead of students spending the traditional 4 years in medical school, they spend 3 years. They are then given early admittance to family medicine residency programs within the Cleveland Clinic and skip that stress of an agonizing match process.
I think this type of experiential training really helps them learn faster and really gets that kind of meaningful work and purpose back into their lives and in primary care.
Students within the Heritage College Cleveland campus started the first ever cohort back in 2018. It is team-based, patient-centered care that focuses on a growing population. After learning the ropes, they conducted research and immersed themselves in the field, working directly with healthcare teams in Cleveland.
So we got a half day per week seeing patients with one of the attending physicians at our residency site. So not just some random location in the area, it was our residency site that we were going to go to.
They studied, completed research projects, and did it all through the ups and downs of the pandemic. The graduates say these real-life encounters trained them for the next steps in their careers, and they're eager to be a part of the future of medicine.
It allowed me to learn more about social determinants of health, more about Cleveland as a city and what's going on with it health-wise, and actually being able to make projects and changes and get really connected with the different community partners that are in this area.
I'm excited to, continue to see patients and hopefully make an impact in their life.
And back out here live in front of the Cleveland Clinic, the first class of students actually graduated on June 30th, but they are now enrolling the next class. So if you think you would be a perfect part of this process, simply click this story, news5cleveland.com, as well as the News 5 Cleveland app. And Mike and Tiffany, the students that I spoke with, said a large part of why they entered this field is because they had incredible primary care physicians growing up. So they are now here to be role models, prove that you can be a part of this and make a difference. And they say it simply starts with providing that excellent care. Back to you.
Yeah, and in a way, paying it forward with what they received. Mike, thanks so much.